All right, thank you, Ben. Well, on the medical feed this morning, oral health, or more like oral protection.
Yeah, that's right. According to a new survey, protecting those pearly whites is key to many Americans. So much so, some have even avoided playing sports their entire lives to avoid chipping or even losing a tooth. So joining us now to talk more about those findings and why losing a tooth isn't the end-all be-all to a pretty smile is Dr. Craig Hirschberg, president of the American Association of Endodontists. Doc, good morning and thank you for joining us.
Good morning.
This is pretty interesting to me as someone who's played sports my whole life and didn't have this fear. What did your latest survey reveal about those people who did have those fears of sports-related mouth injuries?
We were a little surprised to learn that about a third of the people surveyed avoided playing sports out of fear of losing a tooth.
What are your tips if someone has knocked out a tooth playing a sport?
So, best thing to remember is time is of the essence. So there should be an attempt, whether it's the person who sustained the injury or somebody that's assisting them, to recover the tooth and try to immediately place it back into the socket. So just shake it free of debris and wiggle it on back in. Now, sometimes it isn't possible or it's outside of somebody's comfort zone. If that's the case, you want to try to get to a dentist, to an endodontist, to an emergency facility to have somebody put the tooth back in the socket as soon as possible. But it's important that the tooth is kept moist during this period of time. So the ideal thing would be if you can get the tooth into a container of milk, and the colder the milk is, the better. Better it would preserve the cells on the surface of the tooth, because that's essential to getting the tooth to reattach to the bone when it's replaced into the socket.
Can you explain the difference between an endodontist and a general dentist?
Sure. Well, an endodontist is a dentist who's returned for a minimum of 2 years of advanced training, and that advanced training is in advanced endodontic procedures, and big part of endodontic procedures would be root canal treatment, learning advanced pain control, and there's a lot of additional technology that an endodontist would be using in their practice. And also want to add that the way that endodontist practices are set up, they're accustomed to accommodating patients who have had trauma or who are experiencing toothaches, to accommodate those patients in a timely manner. So they're accustomed to getting that phone call, and the response is usually, yeah, come right over, and people are taken care of.
And where can we go for more information?
So for general information regarding endodontics, somebody can go to AAE.org, which is our association's website, and there's an entire area of patient information that I think a lot of people would find valuable. And at the same time, if you're experiencing a toothache or you've had dental trauma, you can go to findmyendodontist.com, and there's a database there that allows patients to refer themselves to an endodontic office. So, great resources.
All good things to know, whether it's sports related or with Halloween right around the corner with all that candy around. Dr. Hirschberg, thanks again for joining us.
Thank you. Appreciate it.